know the NHS, know the latest asks, especially now if no one knows that what's the ask from NHS about turnaround time. We should, we should as a histopathologist. So search for that what is the latest strategy, what is the latest, any college, relevant college guidelines latest. So okay. And know the people, meet them. I have already, I can't stress it enough that people would be happy to see you, even if they say that we are not, we are busy. It happened to me also that we are busy or something. Just have a chat. Just ask for the chat. Ask for the Teams meeting. Ask for the show your interest, please. That will make you an outlier candidate in the interview, I'm telling you. And it may seem a bit awkward for us because we don't like, first thing, we don't like to put ourselves on the, the podium. Second thing is that by we means IMGs, and we don't want to show that, oh no, we are dying for the job, or we are a bit skeptical about that they would think that, oh, we are trying to bribe them or do something or something. No, please show your interest. If you want to get the job, show it that you want to get the job. And again, for substantive, I would suggest that try to meet all. Send a very polite, very professional email beforehand that if we can have a meet, and I would like to have a pre-interview. That's called pre-interview meet. So for that, and even again, repeating, for locums, please apply for, please try to meet on Teams, online, chat, phone, something. Try to make contact. I can't stress this enough. So, okay. So this guideline came yesterday. And for the people who are applying now recently or who have interview in a coming few weeks, so please, apply for, see those things, the latest guidelines, the latest any, strategic. So this one is for workforce. And now they have said that 6 steps for next 4 years. So you should have just an idea that these things are there. These things are, so how to prioritize, number 6 is prioritize patient care. So how to support, prioritize, and manage workload in the face of adversity. So those things should be, you should know at least few of these. And again, I would say, even if they are not asking you any questions about this, try to drop, not a bomb, but try to drop some, point between any other question. So you can say that if they ask you that what's your strength, and what's your most important strength, and what are your strengths? So you can say that I am very good at managing workload. For example, the college has published this. So it will make you stand out from all the other, candidates. Okay, communication skills, yes, yes, yes. Can't again stress it enough. Be friendly, smile, and it is difficult situation, but I would just give example that in the interview for BMS, which I was telling, one got really nervous and drinking water again. So this is not a bad thing, because yes, but try to, it's not a life or death situation. Relax, enjoy the interview process, I would say. Just think of it as you are here for, interviewing, exchanging your views about something. That's it. Don't take it as a very difficult or very, stressful situation for yourself. Then if it is online, then audiovisual aids, background. Right now, like I'm sitting at home, the background is not that I would show you that, but be professional, be the light, the sound should be, no, there shouldn't be any noise. So these are simple minor things But I have seen people doing interview on cell phones also. So I'm not saying that you should buy a very expensive, phone or something, but please be professional in that, and be very thorough in using. Like at the start, you saw me that I was thinking that something is wrong, something is not, because I've got three screens, and on one of the screen the presentation is there. So be relax. No need to panic. People are too many over here. I was expecting maybe 10, 15. So no need for, just enjoy the process. So I'm enjoying presentation. I'm enjoying putting out myself in a difficult situation for, not for you, for, I would say, myself also. And be confident. Don't be a robot, please. I have seen people, they will answer still, and okay, so what's my name is Saruna Harun, and I'm a consultant histopathologist. And so, and if I say, oh, my name is Dr. Saruna Harun or Saruna Harun, and I'm a consultant histopathologist, and I've been, so, again, a question I have answered actually over there also, that only 7% in communication, only 7% impact is for our words. 38% is tone, tempo, volume, timbre. So I always give example that keep your tone not like mild, friendly. Sometimes our accents are very, we do have an accent sometimes. So try to speak clearly, softly. Initially, you would see that if I don't know if any one of you noted or not, but I was using a lot when I started this presentation. Now I have, I'm at a plateau. So not using the filler words. Don't use too much ums, ahs, and posture should be there. So 70 something, or maybe I think 60 something is for your posture. And what's posture? Eye contact and your facial expressions and your body posture. So you should be relaxed. You should be, I'm not saying that just lie back on the chair or something like that, but you should be relaxed. Shoulders dropped, open posture. Duchenne smile. Duchenne smile is like the original smile, where your eyes smile with your actual. So don't, other people can sense. I'm not saying that don't like smile a lot. Sometimes I have a bad habit to smile in a very, silly situations. So don't be like me, please, but do smile. And build a strong rapport. And matching and mirroring, this is also important, that if a person is doing an action, you mirror them, do opposite or match them. So that makes you,
Yeah.
sorry, you want to, okay. So uh, communication skills, body language, this is very important. And then memorize, please, because most of us, English is not our first language. Memorize the power words, and uh, most of us, I think, know Shah Rukh Khan, and most of us, if people know me, they know that I'm a big fan of his personality and his speeches. So, I'm not saying that not for his, I don't know, I'm not commenting about his acting or as an actor, but as a personality overall, how he has groomed himself, how he has put up. So he says that, success will not wait, things will go on, pain will be there. If you have, heard that clip or seen that clip for his small speech. So you have to work hard. So you have to, first thing is that work hard on yourself first. And you have to do that. And don't think that, oh no, people, I'm like this and I'm like that, and people should like you automatically. People might, I'm not saying we are, no, none of us is a perfect being in the world, but sorry, two people are waiting. Okay, so but memorize certain power words, memorize certain quotes for your favorite. There must be a favorite for you. It's not that either it's a anyone. It need not to be a histopathologist. Although I have got many favorite histopathologists also, but see how they. What's the thing you like about them? What's the thing? So in interview, it's important. I can't stress it enough. Literally, that communication is the first and foremost thing. And as again, I'm saying that I've been on both sides of the table. And then if people go out, tell a story, tell about, be relaxed, be confident, because most of us are competent. Most of us are independent consultants. We have been there in our working in our hospitals and universities or wherever we are working in the labs. We know our stuff about histopathology, maybe much, much more than a fresh trainee, but you have to be, you have to show it. No one would know that who are you unless and until you have to, just, I say that just brand yourself. Okay, how long an answer should be? I myself is very fond of talking. So I needed to stop myself in most of the interviews at 1 to 1.5 minutes. So if people start talking too long or very short, it's not. So most of the answers, unless and until like it's 3 minutes, because remember, the panel have to take interview for multiple candidates. They are there for maybe the whole day. And just I gave example for BMS. I had to talk to them about 4 hours. So it's not an easy thing for the person sitting on the other side. So make their life easy. Divide your answer into chunks. Remember, memorize, practice power words, and 3 to 4 points. And also remember that other people can see through it very easily if you are bragging or exaggerating a thing. So stick to the facts, I would say. That don't try to go overboard, but try to highlight your, you know, what you have done and what you have. So when people call, or when people, even these days, many people, because that's why I put this session, that people were asking about you know, the interview process. They were asking about the Caesar process. So maybe I'm thinking, let's see if I find time, I'll do few sessions for Caesar also, because I'm a portfolio assessor. But interview, I thought that Caesar, yes, you are getting some, help from group and from those things. And it's not like you have to present yourself. But in interview, please present yourself, talk slow, talk clear. So this was the portfolio session where I was asking about, Caesar pathway. I'm talking about Caesar or portfolio pathway. So I might do some sessions for that, Saint, and let's see if I get time, and if my family allows me. Okay, so portfolio station, that is, tell us about yourself. So usually it would be the first question for locums, and in substantive also I had prepared a 3 minute talk about myself, but they didn't ask it directly. So I had to, but now maybe you people know me. So I had to fit it into some other scenarios, and I told them everything about myself. So I had a very nice example. One of my oncology friends, she was very kind enough that she sent me the 3 minute talk for herself, which she did in as a Microsoft Word document. So you have to write and you have to memorize. You remember the childhood, sometimes in the school you have to do a speech and then you memorize it. And so do it similar to that. This reminds me of a joke also about that. The one person, he memorized a speech about best friend. So the topic came about dad. So he said that I have many dads, but Rajinder Singh is my best dad. And so this is just a joke, sorry. And I'm fond of telling jokes also. But uh, and do tell a joke. Not like uh, non-relevant kind of joke, but only if it's relevant. So now because I'm talking about communication skills and presentation, so I told the joke. So, but please don't drop those kind of jokes in the interview process. So don't forget the job description again. And in this, you have to sell that if they want, for example, head and neck lead or head and neck, or if they want skin specialist, or if they want, so what does the JD shows in the interview, track jobs or the ask. So drop that thing over here again. And this is very important, I'm saying, because otherwise no one is going to see that you'll be, and if you do that, again, you'll be one of the favorites among these. So you have to divide that thing into camp: clinical, academic, managerial, and or management, and personal. And so among these, most important is clinical. And again, your communication skills, your how you present yourself, how you tell them about yourself. So start from the most recent thing, that my current role is this, and why a department should keep you actually. That should be the point. That if the department wants an independent reporter, highlight that. If the department wants some subspecialty, highlight that. Independent reporting is very important because people don't want in their departments a person who will be, non-reliant, or who will, too many asks will be there. So most of the department will support you in the process of portfolio and Caesar. And if you are doing that, and if you have not already submitted, but they want that at least you should be able to take the departmental load. And this is important over here. And how many number of years you have been doing. Maybe in your place of work or outside UK, that doesn't matter. Because once you are doing outside UK, independently, you can always learn, you can always go around that. And it's not very different. People say that I get surprised because I have worked in different countries, and histopathology is same, to be honest. Yes, tweaks and little bit things are there, but it's not like much different. That reports are kind of similar. The clinical asks is similar. The MDTs or tumor boards, which we used to call in previous two place of work, those are similar. Tell them about this. And especially if you are internal candidate for a substantive interview, do not think that they know it already. So I won't tell them. Oh, maybe they will think that I'm bragging. No, you have to, I'm telling you, you are your own brand. So you have to brand yourself. You have to tell them, you have to sell yourself. Tell about your degrees, if you have done anything apart from FRC path. So you can just say that, because remember, not all the panel members would have seen your CV from start to end, word to word. They might have, they might not have. Even if they have, they won't be memorizing. You are not a hero. So you have to tell them briefly in 3 minutes. First is clinical. I would say 1.5 minutes for clinical. So what were your main work responsibilities? If you have done any other, so like for me, I always say that it was a structured residency program similar to the UK thing. And I have done the residency, and afterwards I started independent reporting in 2011. So it's been almost 14 years that I'm doing independent reporting, and for multiple specimens. And there you can drop something about the department, but they want to know about you, not the department. So the department was receiving more than 60K slides cases per year of all the variety, and we used to have multiple tumor boards. I'm telling about the Pakistan experience. And then afterwards, over here, I'm doing this. So from recent, then backwards. And degrees, like I have done from University of Glasgow, I have done certificate for postgraduate medical education. And then I have done courses for academics also, research, few courses for research also. And I have done evidence-based medicine thorough course from Saudi Arabia. Then what were but those things I will tell in the academic, the other. But clinical, again, like Indian MD is there. So no one knows what's Indian MD. So you can just quickly say that I have done Indian MD. It's like 4 years, what I understand, 4-year degree, and we rotate through different subspecialties. And then my interest got developed in histopathology, and then I started, and then I have done FRC path in year so and so. But before that, even I was working as an independent consultant. And especially if you've got another international experience, that gives a level of confidence to the interviewers also that, oh yeah, you will be a very good addition to the department. And what were the main work responsibilities? So if you're doing tumor board participations, if you're doing cut-up, grossing, cytology, just quickly, again, I'm repeating, do not think that they know it already, please. Quickly, concisely tell about it. Then academic, touch briefly, unless they have got the main requirement for that. Like the job description says that they want someone who will be involved in teaching and undergraduates and postgraduates. So sometimes university hospitals do that. So see the job description, so if they have asked for it, then you can go for it in detail. If not, then I won't say that, oh, I was an assistant professor in Pakistan and then I did postgraduate degree. So you can just briefly touch that. Yes, I have got a teaching of undergrads and postgraduate. However, if they have asked it, then I would say yes. In Saudi Arabia, I was residency program coordinator, and then I have vast experience of undergraduate and postgraduate teaching. And then I was an assistant professor in Pakistan, and I have done a short course for the introductory for the medical education. And then I have done. So you see, when I'm speaking, even few seconds have passed. So they are not interested if they are not asking for it. But if they are asking for it, please. If publications, like, okay, if they are asking for something less likely at our level, there would be some job which they'll be asking for, research experience a lot. But if they are asking, then, for example, again, for myself, I can say that even in past 3-4 years, I have published 2 original articles, and I have published in pathologyoutlines.com a few of the pages. And then before that, I have published 36 or 37 PubMed indexed publication. So it all depends what's the ask. But I think over here, just touch briefly if you have got any experience. So, and most of the departments won't be interested that much in this. So don't worry at all. Then management, yes, this is again very important. Just don't say that, oh, I'm the screening program lead. No, what do you do in that? Do you chair the meetings? Do you do the, SOPs, conduct some audits, update some procedures, some QIPs, some change management? So what do you do in that position? Saying is not enough that I was head of department in my previous place of work. No, it's just that what change or what difference did you make as a head of department if you were there, or if you are leading some component of lab. For example, if you are leading special stains in immunohistochemistry, if you are leading grossing bench, if you are leading governance, like for me, if I'm leading the governance, so what do I do? So my job plan has got that, and I have to tell them that I'm doing this, and I have made change this. Again, they are interested. If you are doing some managerial or management position, what is the change or what is the outcome of that? Otherwise, no one is interested, whatever you are, even if you are a medical director of the whole hospital. So, okay. And then lastly, personal. This is very important to give personal touch to all the questions, I would say. Personal touch doesn't mean that you start talking about that, oh, I'm drinking Pepsi Max and I don't like Coca-Cola. And but like time management, multitasking, for example, again, because no one, was kind enough to volunteer, so I will just give examples and brag about myself. So I have got two teenage kids. So I think this is the biggest thing which I do in my life. And so how do I manage my time? How do I multitask? For example, now I'm giving this webinar. How I've tried to, squeeze the time in this. So this is important. This is important for the department, that you are able to manage the time. Hobbies, if you are interested in, playing chess or going for a gym, or so what are your hobbies? Importantly, if those are related to some problem solving or helping or volunteering or something like that, or team spirit. So most of the hobbies do that, and or refinement of your skills. So briefly, you can touch that. So signpost each point very clearly. Our plan is that we will go in interview, we'll tell about them, and we'll reach the target. No, this is the reality. So because we get lost, and practice.